Mr. President.
The Senator from New Mexico.
Thank you, Mr. President, for the recognition. Today, many of my colleagues will come to the floor to speak about the devastating impact that TrumpCare will have on rural communities. I rise to join them in speaking on this topic and on the many other serious flaws in the Republicans' bill to replace Obamacare. When he was elected, President Trump promised he would provide health care for everyone. But President Trump and our Republican friends have turned their backs on that promise. The Republican health care proposal would put insurance companies back in the driver's seat. And that means less quality and more cost for all of us. Rural communities, working families, and people with medical conditions would be hit the hardest. Today, we got a taste of how devastating TrumpCare would be. The President's budget proposal slashes billions of dollars for Medicaid and the Children's Health Insurance Program. President Trump takes direct aim at bipartisan programs that have made historic progress for kids, for the disabled, and for the elderly. Mr. President, former Senator Hubert Humphrey once said, and I quote here, "The moral test of government is how it treats those who are in the dawn of life, the children, those who are in the twilight of life, the aged, and those in the shadows of life, the sick, the needy, and the handicapped." When Senator Humphrey spoke those words, he had been diagnosed with terminal cancer. He died a few months later, and his words are just as meaningful today. Mr. President, TrumpCare fails Senator Humphrey's moral test. It doesn't cover more people or more services or provide health care or improve health care. It raises costs and reduces quality. Compared to the ACA or Obamacare, TrumpCare would be a disaster for families in my home state. In New Mexico, tens of thousands of people have health care thanks to Obamacare and the Medicaid expansion. Before the Affordable Care Act, New Mexico had one of the highest rates of uninsured in the country. It was almost 20% at 19.6%. That rate has been cut in half at 8.9%. Approximately 300,000 more New Mexicans now have health care. And each one of these 300,000 people has a story about how having health care has made a difference, even saved lives. Thanks to the Affordable Care Act, hundreds of thousands of New Mexicans now have essential health benefits, including doctor visits, hospital care, prescription drugs, pregnancy and childbirth, and mental health services, and a range of preventive services like mammograms and other cancer screenings are available at no cost. I'm not saying that the ACA is perfect. Premiums are still too high, deductibles are increasing too much, and we still must bring down the costs of prescription drugs. We absolutely need to work to bring down costs. But on balance, the Affordable Care Act passes all tests, many with flying colors. TrumpCare does not come close. TrumpCare gets an F. Test number one, does TrumpCare increase the number of Americans who will have health care? No, it decreases coverage and decreases it dramatically. According to the most recent figures from the CBO, 24 million Americans will lose health care coverage under TrumpCare over the next decade. TrumpCare would dismantle the Medicaid expansion provisions that help so many working Americans, including 265,000 people in New Mexico. And TrumpCare would hit rural communities the hardest. The National Rural Health Association has said that TrumpCare, and I quote here, does nothing to improve the health care crisis in rural America and will lead to poorer rural health outcomes, more uninsured, and an increase in the rural hospital closure crisis, end quote. Rural areas like we have in New Mexico have more elderly and disabled people, and fewer people have insurance through their jobs. TrumpCare is the hardest on these groups. Rural hospitals are already struggling. They will have an even harder time keeping their doors open. Many New Mexicans would have to drive an hour or more if their local hospital closed. And not only would closed hospitals mean less access to health care, it would also hurt the economy. In rural areas, hospitals are a big employer. If they close, the rural economy takes a hit too. The administrator of the Guadalupe County Hospital in New Mexico, a fine woman by the name of Cristina Campos, fears what might happen if TrumpCare becomes law. She is urging me to protect access to care in rural areas. Guadalupe County is one of our smallest counties by population. The hospital's uninsured payer rate declined from 14% to 4% from 2014 to 2016, thanks to the Affordable Care Act. And its uncompensated care increased 23% in that same period. I can tell you, I will fight tooth and nail to keep residents in our rural areas insured and to keep rural hospitals in New Mexico open. Test 2. Does TrumpCare increase coverage of health care services? No, it fails this test too. Under the ACA, insurance companies must cover essential health care services, period. But under TrumpCare, starting in 2020, states can get a waiver and define their own essential benefits for individual and small group plans. So states would be able to cut the benefits that people count on and that are making patients healthier. Test 3, does TrumpCare make health care more affordable? It doesn't. It takes aim at the most vulnerable working and low-income family and seniors, the people most in need of care, and it cuts access to health care out from under them. If you are older and poor, you lose big under TrumpCare. If you are young and wealthy, you win. What is wrong with this picture? What's wrong is that it's unjust. And it's bad for healthcare costs over the long run. Trump and the Republicans are proposing drastic changes to our healthcare system, and they're changes for the worse. They want to go backward to a time when insurance companies could decide who gets health care and who doesn't. And finally, TrumpCare would hurt anyone with a pre-existing condition. One of the most popular provisions of Obamacare is that it prohibits insurance companies from dropping you if you get sick and from refusing to cover you because of a pre-existing condition. A pre-existing condition could be something serious, like cancer. But insurance companies have considered everything from childbirth to hand warts a pre-existing condition. Under TrumpCare, states would be able to decide whether to get a waiver from those patient protections. And then we would go back to that time when insurance companies decided who could get health care and who couldn't. States would have to set up high-risk pools to provide people with the option of insurance in catastrophic situations. But in the best cases, high-risk pools wouldn't protect many people from going bankrupt just to get health care. And TrumpCare wouldn't provide nearly enough funding for states to run them successfully. Take Alexis from Albuquerque. Alexis is here with her husband. Alexis had a stroke and brain surgeries when she was 28 years old. Even though she had no lingering effects, she was denied insurance in the private market and had to get insurance in New Mexico's high-risk pool. According to Alexis, it broke us financially. Alexis now has affordable health insurance with the help of the Affordable Care Act subsidies. Like most people, she doesn't want to risk going broke just to get health care. She shouldn't have to. Finally, I want to tell you about a 1-year-old from Albuquerque, New Mexico, Rafe. Rafe was born with cortical visual impairment, a kind of legal blindness, and significant developmental delays. His parents, Jessica, his mom Jessica, and his father, Sam, a veteran, have been able to access the intensive medical care, early intervention services, medical equipment, and therapies he needs through a combination of the military's insurance and Medicaid. But TrumpCare jeopardizes Medicaid by turning it into a block grant for states that will most certainly result in deep cuts to Medicaid. It threatens Rafe's chances of a better life. The president promised he would keep protections for people with pre-existing conditions, people who are sick. His broken promises can hurt tens of millions of Americans. In the end, TrumpCare is not a real health care bill. It's a tax relief bill for the richest 1%. The CBO estimates that TrumpCare would cut taxes by $346 billion over 10 years, at the expense of the health care of working families and seniors. Mr. President, our priorities for health care reform should be increasing coverage, increasing the services provided, in making people healthier, and providing affordable health care. I strongly and unequivocally support all Americans having health care. Let's get to that goal, and let's get to that goal now. 91% of the American people are insured thanks to the steps taken under the Affordable Care Act. Rather than repealing it, let's build on its strengths so 100% of people can afford to see a doctor when they're sick. We can do this, we can do better. Let us ensure that Americans in the dawn of life, the children, those who are in the twilight of life, the aged, and those in the shadows of life, the sick, the needy, and the disabled, have the right to health care so that America meets the moral test of good government. And I yield the floor, Mr. President.